Let's change gears a little bit and talk now about nutritional and herbal supplementation for type 2 diabetes. Our objectives are to establish optimal nutrient status for our patients, reduce postprandial glucose elevations, improve insulin function and sensitivity, and prevent nutritional and oxidative stress. Remember, oxidative stress is what really causes a lot of the sequelae of type 2 diabetes. We need to establish optimal nutritional status. We need to make sure that our type 2 diabetics are on a healthy, nutrient-dense diet. Also, high-potency multivitamin mineral supplements are good to improve glycemic control, reduce complications, as well as boost the immune function. Whenever a diabetic adds significant fiber or supplements or botanicals to the protocol, glucose monitoring is needed because medication may need to be reduced. So you want to make sure that once you're recommending these nutritional and herbal supplements, you have to make sure that the patient doesn't develop hypoglycemic episodes. So once these are recommended and implemented, usually ask your patient to check their blood glucose monitoring much more frequently. A physician should be involved in all decisions regarding natural supplementation. Let's talk a little bit about chromium. Chromium works with insulin. It increases insulin sensitivity to increase uptake of glucose into the cells. Chromium deficiency is a factor in diabetes as well as obesity. Supplementing chromium decreases fasting glucose, improves glucose tolerance, lowers insulin, decreases total cholesterol and triglycerides, and increases HDL, high-density lipoprotein, which is the good cholesterol, the protective cholesterol. Reversing chromium deficiency lowers body weight and increases lean body mass. Chromium produces improvement in glycemic control in patients who are chromium deficient. The usual dosage of chromium is 200 to 400 micrograms daily for diabetics for glucose control. Chromium is depleted by refining carbohydrates and a lack of exercise. And chromium picolinate and chromium-enriched yeast is really the preferred route. Here's a picture of a GLUT4 transport protein. You'll see that the insulin receptor sits on the cell membrane. Once insulin sits on top of the insulin receptor, it sends a signal inside the cell. You have post-receptor insulin signaling cascade to stimulate the GLUT4 protein. This GLUT4 protein vesicle produces GLUT4 translocation to the cell membrane. So the GLUT4 protein then sits on the cell membrane, opens the door, and allows glucose to enter through the glucose transporter into the cell itself. So, sweet potato, cinnamon, and vitamin D improve insulin production receptor activity. So you can incorporate these into everyday diet. Once there is post-receptor insulin signal cascade and the upregulation of GLUT4 protein production, this is enhanced by chromium, lipoic acid, magnesium, vitamin D, and inositol. All of these improve insulin signaling. So once you have an upregulation of the GLUT4 vesicle protein, the GLUT4 sits on top of the membrane and allows glucose to enter through the GLUT4 transport protein on the cell membrane. So it allows the glucose to enter the cell. And pycnogenol modifies the glucose availability to the glucose transporters or GLUT4 transport protein sitting on top of the cell membrane. An important supplement for type 2 diabetes is vitamin C. Insulin enhances transport of vitamin C into the cells. Remember, vitamin C is a very potent antioxidant, and you're going to need increased antioxidants because you have increased oxidative stress in type 2 diabetes. Many diabetics have intracellular deficiency of vitamin C despite adequate intake. The major function of vitamin C is collagen, the main protein substance of connective tissue. Vitamin C is vital for wound healing and repair, healthy gums, prevention of excess bruising, immune function, manufacture of neurotransmitters and hormones. One easy question to ask your type 2 diabetics or any patient or client is if they bruise easily. If they do bruise easily, it's usually an indication of decreased vitamin C. Vitamin C reduces hypertension, improves arterial stiffness, and improves blood flow. Vitamin C also reduces accumulation of sorbitol by inhibiting aldose reductase, which converts glucose to sorbitol. Remember before how we talked about the eyes, the kidneys, the nerves, and endothelial cells of blood vessels have increased glucose inside their cell, which is converted to sorbitol, which ends up being cytotoxic. Vitamin C also inhibits glycosylation of proteins, which is wonderful because remember, if you have glycosylation of proteins, this is a non-enzymatic binding of sugar to protein. It actually changes the configuration of proteins and changes the message once the protein sits on the cell membrane. The usual dosage of vitamin C in type 2 diabetes is 1,000 to 2,000 milligrams daily, and some good dietary sources of vitamin C are broccoli, peppers, potatoes, Brussels sprouts, and citrus fruits. We talked about the eye lens, the nerve, kidney, and vessel endothelium. So vitamin C inhibits aldose reductase, so that inhibits the formation of glucose to sorbitol. Also, vitamin C decreases advanced glycosylated end products, the AGEs. Also, vitamin C decreases oxidative stress. And once you decrease sorbitol, decrease advanced glycosylated end products, and decrease oxidative stress, you decrease diabetic complications. Vitamin E is another great supplement for type 2 diabetes. Vitamin E is an antioxidant, and it protects cell membranes, especially nerve cells. It improves insulin action, prevents free radical damage to LDL and vascular lining, which is the first process for developing atherosclerosis. It improves the function of blood vessels and endothelium. It increases intracellular magnesium, decreases C-reactive protein, which is inflammatory, increases intracellular glutathione, which is a very potent antioxidant, improves nerve impulse conduction, improves blood flow to the eyes in diabetic retinopathy, and improves kidney function test. Diabetics require lifelong supplementation. The usual dosage of vitamin E is 400 to 800 international units a day. And here we have a diagram of antioxidant protection. You see that vitamin C helps increase nitric oxide. If you have increased nitric oxide and the preservation of increased nitric oxide, that causes vasodilation. And with oxidative stress, you have a decrease in nitric oxide, and that creates vasoconstriction. It also creates the first steps for developing thrombosis and increased atherosclerosis production, as well as inflammation. Niacin and niacinamide is vitamin B3. This is important in energy production. And remember, you have NAD and NADH in the electron transport chain, which is derived from vitamin B3. Niacin is important in metabolism of fat, cholesterol, and carbohydrates. It's important in the formation of sex and adrenal hormones. And in type 2 diabetes, the adults, the niacinamide dosage is 500 milligrams 3 times a day. Here is niacinamide, vitamin B3, in the mitochondrial electron transport chain. This occurs on the inner membrane of the mitochondria. And here down in the lower left, you see NAD. And NAD is derived from vitamin B3, and NAD goes along the electron transport chain to finally form ATP and energy. So those persons who have type 2 diabetes may be deficient in vitamin B3, and hence they will produce less ATP, producing decreased energy. Therefore, many patients with type 2 diabetes will be fatigued. Vitamin B6 is also an important supplement in type 2 diabetes. Vitamin B6 protects against diabetic neuropathy. It inhibits glycosylation of proteins. Long-standing diabetes or signs of peripheral neuropathy indicate a need for vitamin B6. So when you have your patients or clients talk about numbness or tingling or have any signs of peripheral neuropathy, please make sure that you supplement with vitamin B6. The usual adult dosage is 100 milligrams per day of vitamin B6. Some food sources of vitamin B6 or pyridoxine include beans, legumes, nuts, eggs, meats, fish, breads, as well as cereals. Magnesium is also a very important supplement. Magnesium deficiency is common in diabetics, especially those with severe retinopathy. Magnesium improves insulin response and action, glucose tolerance, and fluidity of cell membrane. About 20 to 40% of the average population is magnesium deficient. So you can do a blood test for magnesium. The best blood test is a red blood cell magnesium level. The dosage is 300 to 350 milligrams per day. However, diabetics may need twice as much. And some dietary sources of magnesium are tofu, legumes, nuts and seeds, whole grains, green leafy vegetables. And here is our diagram of GLUT4 transport. And you can see that in the post-receptor insulin signaling cascade, magnesium is involved in insulin signaling. So magnesium helps make the GLUT4 transport protein. Zinc is also indicated in type 2 diabetes as supplementation. Zinc is a cofactor in 200 enzyme systems and involved in all aspects of insulin metabolism. Zinc deficiency is common in the elderly. Diminished sense of smell or taste may indicate zinc deficiency. The best way to test this is just to have a little test tube filled with coffee beans and just take the top off and ask the patients with their eyes closed to smell the tube. If they can identify coffee, then that means that they do not have a diminished sense of smell. If they cannot detect the smell of coffee beans, think of zinc deficiency. Diabetics excrete excessive zinc in their urine. The dose for diabetics is 30 milligrams of zinc a day, and dietary sources again are whole grains, legumes, nuts, and seeds. There are zinc transporter proteins on the cell membrane, and it has an effect on glucose, pancreas, the liver, and insulin clearance. So zinc transporters regulate glucose metabolism. Let's talk about omega-3 fatty acids from fish. These help lower lipids and blood pressure. Omega-3 fatty acids are anti-inflammatory. Remember that type 2 diabetes is a total body inflammatory process, so omega-3 fatty acids are really important. Omega-3s also promote insulin sensitivity. Omega-3s are usually lacking in diabetic diets, so if you ask your diabetic patients and clients about their food diary, you'll find that many of them don't include fish, fish oil, nuts and seeds, organic eggs. Omega-3s also protect against heart disease. Fish oil has no adverse effect on glycemic control, and the dosage of combined EPA and DHA is about 1,100 to 1,600 milligrams per day. Now, that's the EPA and DHA dosage. It's not the fish oil dosage, because fish oil, if you're taking 1,000 milligrams of fish oil, may only contain about 500 or 600 milligrams of EPA or DHA. So ask your patients to bring in the bottle of EPA and DHA, or ask them to bring in their bottle of fish oil, and actually look on the label and see how much EPA and DHA are in each capsule. So the total amount of EPA and DHA consumed should be between 1,100 and 1,600 milligrams a day. Remember, omega-3s help keep cell membrane function healthy. It keeps the cell membrane fluid, and that's where your insulin receptors sit, right on the cell membrane. So a healthier cell membrane allows for healthier function of insulin receptors. Fiber supplements are also important in supplementing for type 2 diabetes. Fiber supplements enhance glycemic control, decrease insulin, and reduce calories absorbed from food. Fiber reduces postprandial glucose, lowers cholesterol, and promotes weight loss. Water-soluble fiber forms a gelatinous, viscous mass which slows absorption of glucose, reduces calorie absorption, and increases satiety. Water-soluble fibers such as glucomannan, psyllium, guar gum, defatted fenugreek seed, seaweed fibers, ground flaxseed, and pectin can all be used. A fiber supplement called PGX is a combination of glucomannan, alginate, and xanthan gum that coalesce and form a matrix that has a viscosity 3 to 5 times greater than glucomannan alone. So it gives you a feeling of fullness, and PGX reduces glycemic index of any food by 15 to 70% and reduces postprandial blood glucose. So taking PGX decreases the rapidity in which the glucose is absorbed. So it decreases the glycemic index by 15 to 70%. So there's soluble and insoluble fibers. Soluble fibers form this viscous gel formation in your stomach. It's highly fermentable, so it increases the production of short-chain fatty acids. Short-chain fatty acids are needed to keep the enterocytes, which line the gut, healthy, and short-chain fatty acids also have an effect on gut microbiota. The key effects of soluble fiber: it decreases postprandial glucose response, so it decreases the glycemic index. It decreases total and low-density lipoprotein cholesterol, and it decreases gastric emptying. Some of the attributes of insoluble fiber is that it's non-viscous, non-gel forming. At best, it's moderately fermentable, and it has no relevant effects on the short-chain fatty acids. Insoluble fiber increases gut transit time and decreases dietary protein absorption and decreases insulin resistance. Insoluble fiber consistently reduces the risk for type 2 diabetes. So if you combine soluble and insoluble fiber, they decrease energy density of food, increases bulking effect, it increases satiety, decreases weight gain, and it has a varying effect on gut hormones and adipokines, and definitely decreases inflammation. Let's now talk about natural glucosidase inhibitors. Alpha-glucosidase enzymes line the intestines and break down carbohydrates into absorbable glucose. Inhibiting these enzymes can decrease postprandial glucose insulin. Here's a diagram of alpha-glucosidase. So alpha-glucosidase enzyme lives on the brush border of the intestine. So, as oligosaccharides come down, the alpha-glucosidase breaks down the larger oligosaccharides into monosaccharides, which is glucose, which is then absorbed and increases the postprandial hyperglycemia. So if you have something that inhibits the alpha-glucosidase enzyme, then you cannot break down these larger oligosaccharides into glucose, and therefore you have fewer glucose molecules that are formed, and you have less postprandial hyperglycemia. So some natural glucosidase inhibitors are the tawuchi, which is an ancient Asian fermented soy product. In type 2 diabetes, 300 milligrams of tawuchi before each meal for 6 months reduced fasting glucose by 10 milligrams per deciliter or more in 80% of patients, and hemoglobin A1C decreased by 0.5 or more in 60% of patients. There are no side effects and no GI complaints from taking tawuchi. Another natural glucosidase inhibitor is the mulberry plant, which is really food for silkworms. In a study, a dose of 3 grams of mulberry per day versus a tablet of glyburide, which is a common oral hypoglycemic drug of 5 milligrams per day. Each one of these were given for 4 weeks, and mulberry lowers fasting glucose by 27% in diabetics. So mulberry acts as an antioxidant. It reduces lipid peroxidation of red blood cell membranes, and it decreases membrane cholesterol in type 2 diabetes. You can have mulberry tea, mulberry plant, not necessarily the silkworms, but mulberry plant tea. Achieving ideal body weight improves insulin function and sensitivity. We'll recommend to your patients to follow dietary and lifestyle recommendations, which would include high-potency multivitamin and mineral supplements. And some of the dietary approaches can be a low-glycemic Mediterranean diet, a DASH diet, which is dietary approaches to stop hypertension, plant-based diets, and a diabetes plate method. And let's walk through those. Here's your Mediterranean diet pyramid. We always have to make sure that our clients are physically active and enjoy meals with each other, have decreased stress. And the bulk of a Mediterranean diet are going to be fruits and vegetables, whole grains, olive oil, beans and nuts, legumes, fish and seafood. There's a lot of omega-3s, smaller amounts of poultry, eggs, cheese, and yogurt, very little meats and sweets, lots of water, and the average amount of water intake recommended is 1/2 of the patient's body weight is equal to the amount of ounces of water recommended for the day. So if somebody weighs 180 pounds, then 90 ounces of water would be recommended for the day. And red wine because of the resveratrol, which is an antioxidant, in moderation. So this is a Mediterranean diet recommendation. A DASH diet can also be recommended to your type 2 diabetics. A DASH diet is dietary approaches to stop hypertension, and this limits the amount of salt consumption per day to 3/4 to 1 teaspoon per day. Some of the DASH diet rules are to have 3 meals and 1 to 2 snacks, to fill your plate with colorful vegetables. Remember, the more brightly colored fruits and vegetables you have, the more antioxidants are in those colorful fruits and vegetables. Add protein-rich foods for meals and snacks. Choose low-fat or non-fat dairy to boost protein. Add fruits to satisfy your sweet tooth. And add nuts for snacks. They are also very rich in protein. For your vegetarian diabetics, you can recommend the vegetarian diet pyramid. Of course, daily activity, at least 150 minutes of physical activity per week. At every meal, you're going to have legumes and beans, whole grains, as well as healthy fruits and vegetables. On a daily basis, consume some plant oils, especially those high in polyunsaturates, such as olive oil, egg whites, soy milk, and some dairy, nuts and seeds, and on a weekly basis, have few eggs and sweets. Alcohol in moderation, especially red wine, and the adequate amount of water. Remember, half of the patient's body weight is equal to the ounces of water per 24 hours. And this is really easy to recommend to any patient. It's a healthy way of eating. It's the plate method, where half of your plate has at least 2 different kinds of vegetables. 1/4 of your plate will be meat and meat alternatives, such as fresh and lean meats and legumes, and the other 1/4 would be grains and starches, such as sweet potatoes, brown rice, and milk or milk alternatives, and a serving of fruit. Supplements to improve insulin function and sensitivity are Gymnema sylvestre. This is a plant native to tropical forests in India. It's effective in both type 1 and type 2 diabetes. It enhances production and activity of insulin. It promotes regeneration of pancreatic beta cells. And applied to the tongue, it blocks the sensation of sweetness, and subjects ate fewer calories at meals compared to a control group. Gymnema sylvestre decreases cravings for carbohydrates and enables patients with type 2 diabetes to follow a lower carbohydrate diet. Capsules or tablets do not produce the same effect as applying Gymnema directly to the tongue. A dose of 200 milligrams per day is recommended, and diabetics on insulin must monitor blood glucose levels because insulin doses may have to be decreased. You have to monitor your patient to make sure that they don't develop hypoglycemia. So if you're going to recommend Gymnema sylvestre, I recommend that the patient does more frequent blood glucose monitoring via finger stick. Bitter melon and balsam pear can be used to improve insulin function and sensitivity. They produce a hypoglycemic compound that's composed of mixed steroids. Bitter melon is more potent than the drug talbutamide, and fresh juice extract of an unripe fruit can lower blood sugar in clinical trials. So the dose of 2 ounces of fresh juice of bitter melon can help improve type 2 diabetes. And other health benefits of bitter melons, in addition to diabetes management, is digestive issues, heart health, anti-aging, and regulates blood flow. Panax ginseng can also improve insulin sensitivity. American ginseng is the most evidence-based herbal therapy for type 2 diabetes. Whole powdered American ginseng root at 3 grams before each meal reduces postprandial glucose in type 2 diabetes. Panax ginseng at 200 milligrams elevates mood, improves psychophysiologic performance, and reduces fasting glucose and as well as body weight. So ginseng has been used as a diabetic herb for over 5,000 years. Supposedly it improves vigor, it nourishes the nervous system, it enhances hormonal secretion, lowers blood sugar, reduces cholesterol, and increases immunity. So this herb has been around for a very long time. Fenugreek seeds can also be used for controlling blood sugar. The active ingredients in fenugreek are soluble fiber, an alkaloid, and 4-hydroxyleucine. Fenugreek can be used in both type 1 as type 2 diabetes. It improves glucose tolerance improves LDL as well as triglycerides. In type 2 diabetes, 1 gram per day of fenugreek seed extract for 2 months improved blood glucose and decreased insulin output, indicating improved insulin sensitivity. So fenugreek for diabetes helps control glucose as well as cholesterol levels in blood, and it can lead to lower heart disease as well as decreased strokes. Onions and garlic, Allium cepa and Allium sativa, have blood sugar lowering actions. The active ingredients are sulfur-containing compounds, allyl propyl disulfide, or APDS. APDS lowers glucose by competing with insulin, which is also a disulfide, for insulin inactivating sites in the liver, thereby increasing free insulin. The dosage of these APDS, the sulfur-containing compounds, is 125 milligrams per kilogram, and this decreases blood sugar and increases serum insulin. Onion, 1 to 7 ounces per day, reduces glucose, and garlic improves glycemic control, lowers cholesterol, as well as blood pressure, and inhibits increases in fibrinogen. So if you inhibit fibrinogen, then you decrease the probability of forming a clot, and therefore you decrease atherosclerosis, a heart attack, or a stroke. Garlic contains allicin, which works at reducing the sugar level in the blood. Onion has hypoglycemic properties as well. So combining these in everyday diet is one easy way to help reduce blood glucose. Now let's talk about preventing nutritional and oxidative stress. We know that there is increased oxidative stress in all type 2 diabetics. Diabetics have elevated damaging pro-inflammatory free radicals and oxidative compounds. You'll need to flood the body with antioxidants to counteract negative effects of free radicals and pro-oxidants. So use flavonoid-rich extracts, remember darkly colored fruits and vegetables, as well as alpha-lipoic acid. Flavonoids are a diverse group of phytonutrients or plant chemicals, and they're found in almost all fruits and vegetables. Along with carotenoids, they are responsible for the vivid colors in fruits and vegetables. So the more brightly colored fruits and vegetables you consume, the more flavonoids you are consuming as well. Like other phytonutrients, flavonoids are powerful antioxidants with anti-inflammatory and immune system benefits. Quercetin promotes insulin secretion and inhibits glycosylation and sorbitol accumulation, so this helps keep the cells healthy. Bilberry and hawthorn extracts help diabetic retinopathy and microvascular abnormalities. Flavonoids increase intracellular vitamin C, decreases leakiness and breakage of small blood vessels, prevent easy bruising, promote wound healing, and supports immune system. And foods that are high in flavonoids are your citrus fruits, your brightly colored fruits and vegetables, brightly colored berries, onions, legumes, green tea, which has epigallocatechin gallate, and red wine, which has resveratrol. All of these are very potent antioxidants. Quercetin is wonderful for type 2 diabetes. It has multiple effects to control blood sugar. Quercetin affects muscles by increasing insulin receptors, increases GLUT4 transport protein, so you have increased glucose uptake and controlled glycemia. Quercetin also affects the liver by increasing glucokinase activity, enhances glucose storage, so you have controlled blood sugar levels. Quercetin affects small intestines, and it reduces glucose absorption. Quercetin also affects the pancreas by increasing pancreatic beta cell regeneration, which then produces increased insulin secretion. And quercetin also decreases oxidative damage to the pancreas. Another wonderful supplement to reduce oxidative stress is alpha-lipoic acid. It's one of my favorites. It is a vitamin-like substance. It's the nature's perfect antioxidant. It's absorbed very efficiently. It easily crosses cell membranes, and it quenches both water and fat-soluble free radicals within the cells and intracellular spaces. So we have two compartments in the cells. We have the lipid phase, the lipid part, and the water phase, the water part. And you could have oxidative stress in both parts. Most supplements only work in the aqueous part of the cell or only in the lipid part of the cell. But alpha-lipoic acid works in both parts of the cells to quench free radicals. Alpha-lipoic acid has been approved for diabetic neuropathy in Germany. The standard dose of ALA or alpha-lipoic acid is 300 to 600 milligrams a day. It improves glucose metabolism, improves blood flow to peripheral nerves. It stimulates regeneration of nerve fibers and increases insulin sensitivity. So here we are. We're back to our GLUT4 transport protein diagram. And again, you can see in the post-receptor insulin signal cascade, lipoic acid is involved in insulin signaling, where it helps produce GLUT4 transport protein that goes up to the cell membrane, which then opens the door to allow glucose to enter the cell. There's a relationship between diabetes and Alzheimer's disease. Alzheimer's disease has also been termed type 3 diabetes. As we can see here on the left side of the slide, hyperglycemia causes an increase in glucose. With an increase in glucose, this elevated glucose is toxic to the mitochondria. Also, elevated glucose produces advanced glycosylated end products. When you have toxicity to the mitochondria, you cause a dysfunction of the mitochondria, which produces an increase in reactive oxidative species. This increase in reactive oxidative species then goes on to produce oxidative stress. Advanced glycosylated end products also produce reactive oxidative species. Inflammation, in which we know that diabetes is a total body inflammatory process, also increases reactive oxidative species. The increase in reactive oxidative species is toxic to the mitochondria, causing mitochondrial dysfunction, and increased reactive oxidative species produces increased oxidative stress. Increased oxidative stress, in turn, creates more reactive oxidative species, and so we're in this downward spiral of mitochondrial dysfunction. If the mitochondria are dysfunctional, then the neurons don't function, and as a result, in addition to mitochondrial toxicity, you get neuronal toxicity, and with neuronal toxicity, you get Alzheimer's disease. In diabetes mellitus, type 2 diabetes, when you have type 2 diabetes, you have intracellular calcium homeostasis and mitochondrial dysfunction. So if the mitochondria aren't functioning properly, that means you can't keep the neuron functioning properly. If you can't keep the neuron and the neuronal membranes functioning properly, you have an increase in intracellular calcium. An increase in intracellular calcium is neurotoxic. You actually get death of neurons and neuronal dysfunction, and this leads to Alzheimer's disease. So diabetes and Alzheimer's disease, mitochondrial dysfunction, oxidative stress, and increased intracellular calcium all lead to Alzheimer's disease. So when you have patients and clients with type 2 diabetes, you may want to do a mini-mental test on them and see what their mini-mental score is, which is the first step for screening for Alzheimer's disease. Well, it has been a delight going through this conference with you. I hope you enjoyed it and hope you all have a great day. Thank you. Hello, I'm Dr. Sylvia Regalo, and welcome to an integrative approach to type 2 diabetes. Well, it has been a delight going through this conference with you.